If you talk to nurses, they will tell you that we are in a crisis in the healthcare industry. Nationwide, tens of thousands of nurses have gone to the picket lines protesting what they're saying are poor working conditions, a lack of training for new hires, being overworked and underpaid, and that it's more dangerous for them on the job.
And they are exhausted. And now nurses representing one of the country's largest hospital groups are set to walk off the job this morning. Kelsey's here with the details. And Kelsey, how many people are we talking about here?
Marky, thousands of nurses in Texas and Kansas are hitting the picket lines this morning. The effort is part of contract negotiations addressing a chronic staffing shortage issue and workplace safety. Now, the hospital system says health care is a top priority and has a plan in place to avoid any disruptions. They're the largest nurses strike in Texas and Kansas history. A union representing hundreds of registered nurses voting unanimously to authorize a one-day strike, frustrated by the working conditions across 3 Ascension hospitals.
Being able to strike for one day because Ascension refused to meet with us and provide a contract that covers all of that, including safety for our patients, is worth it to kind of send the message that we're not going to put up with this.
Whitney Steinecke is a registered nurse at St. Joseph Hospital. She says providing quality health care is becoming increasingly challenging.
You have nurses who are put in situations where they are taking 8 or 9 patients, somebody's mother, brother, sister, and they are not able to give them the quality care that they need and that they deserve.
The union says management has dismissed their concerns. Complaints ranging from inadequate training to a delayed response to hospital alarms and crying babies. Nurses in Austin will be joined by hundreds of their counterparts in Wichita, Kansas, who also agreed by an overwhelming majority to walk off the job. Ascension management expressing its disappointment in a statement that reads in part, "While as a ministry of the Catholic Church, we affirm the right of our associates to organize. We are disappointed that the National Nurses United made the decision to proceed with a strike, especially given the hardship this presents for our associates and families." They say nurses who don't show up for work can't come back until July 1st. Strikers say the threat of a lockout is just a scare tactic and won't deter them from fighting on. They're hoping to pick up where their colleagues in Oregon left off.
We know that the nurses and caregivers' working condition is our patients' healing conditions.
Yes. Nurses in Portland now back at work after a 5-day strike, calling for better pay, affordable health care, and more time off. But nurses are still simmering between the nurses union and health officials over an accusation that Providence violated state law by hiring what nurses say are professional strike breakers. Hospital officials standing by their decision to hire replacement workers to fill in. The nurses' strike in Texas and Wichita are up against Ascension, one of the largest healthcare systems in the country. It was also part of the New York Times investigation back in December that found staffing shortages were caused by years of employee cuts in favor of the bottom line.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.